Thank you for watching Lyra Scoop. We are glad you are here.
Yes, hello viewer, welcome back to our YouTube channel. That is Lyra Scoop TV, and if it is your first time watching us here, please remember to subscribe, share, follow us so that YouTube recommend this video to 1,000 followers outside there. And remember, today is another exciting day and we are introducing a new show that is On Focus. And On Focus, today we are focusing on one disease that normally people suffer from, but in most cases people tend to ignore it. That is UTI. And for today we have an amazing guest, and is someone who is ready and willing to be open some of these causes, the causes of this disease, what is UTI, and some of the signs and symptoms of UTI, because we understand people normally undergo through this not realizing they have this in them. So we have an amazing guest, and he's going to introduce himself to us and tell us more about this disease. Yes.
Thank you so much. I am Norman Destiny Ajerochen. I am the vision bearer of Life Spring Medical Center.
Wow.
Life Spring Medical Center is located in Kirombe, in a place called Tealoy. Yeah, we offer a wide range of services ranging from diagnostic to treatment.
Yeah.
Meaning we are able to first of all know the root cause of that disease that somebody is suffering from.
Yeah.
That is the laboratory aspect of it, to treat it.
Yeah.
So we have vaccination, we do free vaccination, we have family planning services, we have minor surgeries, we have medical consultation. We offer free consultation.
Yes.
You can come to us for imaging. We do also imaging.
What do you mean by saying imaging?
We are able to see the internal organs and
Yes.
stuff like that.
Yes.
We offer ENT services, meaning ear, throat, ear, neck and throat services. We are able to help you in case something is stuck in your nose. Feel free and come. In case something is in your ears, feel free and come. We are able to help you.
So they call it foreign bodies, right?
The foreign body.
Yes. Yeah, thank you very much, Norman. Thank you for honoring our invitation, and we are glad to have you here.
Anytime.
And going to our topic, we have been hearing UTI all over the community we live in, and sometimes it takes us time to understand this. What is UTI, and how best can you explain to someone this is UTI?
Bendro.
Yes.
UTI is a very, very friendly disease.
Wow.
Yes. It's friendly in such a way that if you treat it well, it subsides and heals very well.
Yes.
It is also a very, very bad disease. If you don't treat it well, it can affect other organs. When you talk about UTI, this is urinary tract infection.
Yes.
Infections that are always along the urinary tract. The urinary tract comprises of right from our urethras,
Yes.
both ladies and men. We have the ureters, we have the bladder, we have the kidneys, and so forth.
Okay.
You get to realize that all these sets of infection, if it is not well managed, there is a very high possibility of it affecting other parts of the body. Basically, this urinary tract infection comes as a result of infection that is bacteria. But sometimes other lifestyle that we involve ourselves in makes us also at a risk of getting this tract infection. For example, you take too long emptying your bladder, you pose yourself at a risk of getting this urinary tract infection. Sometimes contamination by the bacteria comes in. Okay? Yes. For the ladies, you get to realize that we have what we call normal floras in our bodies. And once there is this normal floras in our bodies, this normal floras helps us to fight against the diseases. But any slight opportunity, they become what we call opportunistic infection. They're able to cause infection. So, case in point, we have a very, very good friend of ours we call E. coli.
E. coli.
Yes. So this bacteria is always found in the colon. The moment this bacteria migrates or disintegrates from the colon into the vagina, it gives the ladies urinary tract.
That only happens with the ladies, or?
Yeah, basically this is for the ladies.
Yes.
You also get to realize that there are other times that you don't keep the sanitation or the hygiene of your the female area well. That is the area of pride. You take so long bathing, you take so long changing your pants, you pose yourself so much at the risk of getting this what? The infection, the urinary tract. To a smaller extent, sometimes this urinary tract infection comes as a result of being sexually active. Meaning, if I am having the urinary tract infection, I'm so much at a very high chance of giving it to my partner. You get that?
Yes.
So meaning it's very advisable that if we get to realize that a partner or a couple, one of the couple is affected, we treat both what? Couples. You get that? So you get to realize that this infection is divided or classified into what we call the lower urinary tract infection and then the upper urinary tract infection.
Maybe before we move further, let's say a moment realize like one of the partners is affected and the other is not yet affected, and let's say the other started treating it before being affected. One day treatment cause some harm?
No, the treatment cannot cause harm.
Okay.
The partner is already at a very high risk.
Yes.
Maybe by the time of testing,
yes,
the bacteria was undergoing an incubation period. It had not yet come out.
Okay.
You get that, right?
Yes.
So meaning if you start that treatment, it can clear this.
Yes.
So all of you can achieve that goal of treatment.
Yes. Okay.
If a partner chooses to treat immoral self secretly, trust me, that UTI can never get out of that family or out of that courtship arena.
All right.
Yes.
Yeah, because you understand UTI is one of the like infections that normally many people fear to disclose it out to their partners, and because it comes with a lot of issues. It arises a lot of issues instead. And I don't know how best can we influence the community to start like treating this as a couple.
Okay. First of all, we need to let this be known that UTI, to a very small extent, it is sexually transmitted.
Yes.
That is some of the reasons as to why very many couples fear disclosing. Because now if you go and a lady goes and tells a man that, you know what, I'm having this UTI, the man automatically will start suspecting that the lady is what? Cheating.
Yeah.
You get that? Which makes it very, very hard for a woman to disclose this. So you get to realize that we need to let the community know that this infection does not only manifest as a result of sexual encounter, but also other factors. Remember, as a man, we have longer urethra.
Yes.
But a lady has a very short urethra. Meaning, if today the lady gets this UTI, within the first few hours, it has already what?
She has to release.
Disseminated itself to other parts. But a man will take some time because this bacteria has to move up to other organs following this long line. You get that? Yes, but for a woman it's just very short. So somebody will ask this question, that does it affect only adults? It affects even young children.
Young children.
This infection affects male and female, young and adult.
When you talk of young children, because we understand there are also young adults as well, and let's talk about the age brackets. From what age?
You get to realize that this UTI at some time, if it is not treated during pregnancies, we really pose a very, very big threat to this child being born with it. That is the congenital UTI. whereby, you know, the child has to come through that canal.
Yes.
But that canal is not clean. So definitely the child will have to what? Contract it through the mother's canal. You get that? And also, adolescent, they suffer so much because they don't know how to take good care of themselves. I told you at first that this disease is a very friendly disease, but very disastrous if it's not managed.
Not managed.
So during pregnancy, I'm talking about pregnant women.
Yes.
During pregnancy, it is a leading cause of miscarriages. Yeah, because this goes and affects the fetus directly, and it makes this placenta to get out of the walls.
Yes.
Yes. So the signs and symptoms of this infection, there's so many. It presents differently.
Yeah, maybe before we move there, during when you are trying to elaborate on this, the infections, how like most of us get affected, and you are elaborated more on women living along men, and you said like the percentage that will get affected through sexual transmission is so low.
Yes.
So I don't know if you could also share some of other areas where we can get these infections from.
In schools, we can get it through sharing or bathing in the same shelter. You know, this infection, it's able to stay for a very long time. That's why most girls, once they join boarding school, they really suffer so much from this.
Yes.
Because they get it through what?
The shelters.
Shelters, sharing other vehicles like towels.
Yes.
You know, kids have that mentality.
Yes.
They share it through that. And then poor hygiene is a leading cause. Poor hygiene of the genital area.
Yes.
Even for the men, if you're uncircumcised, that discharge that comes out, that powdered substances that is on the tip of your penis or down there, if you don't clean it, you're most likely to suffer from this, because it goes and forms another thing.
Okay.
You get that? Yes.
All right. When you are like, you emphasize more of women, and I'm still also there. Look at the gender. Which gender is more prone to these infections?
Women are so prone to this infection, given the fact that their urethra or the tube is very short compared to men. Okay,
thank you very much, Norman, for that. And as we move further, someone outside there would love to inquire. Let's say you said it's very harmful or dangerous when not treated, and I don't know, I would love you to share like some of the risk factors, like when this infection has taken so long without being treated. What are some of the risk factors that someone may undergo through?
Untreated UTI poses a very big threat to our bodies, ranging from temporary infertility to permanent infertility. You will appreciate the fact that untreated UTI will change into something that we call PID, pelvic inflammatory disease. These are sets of diseases that inflames or affects the pelvic region, the organs that are associated to
around
the pelvic region, around the waist, whereby we shall have the uterus, we shall have the kidneys are there, we shall have the urethras, all within there. That is untreated UTI. You get that? So treating this PID becomes now very hard, because a lot of medicines and various classes of medicine needs now to what? To be used. You can now not use only a single medicine. You get that?
Yes.
So sometimes this untreated UTI, after inflaming the pelvic region, sometimes it goes and enters into the uterus for the ladies, or even for the men, causing scarring. You know, once the tubes has already scarred, there is no way that the ova or the eggs will move and the sperms will move and the meat to have fertilization taking place. But For the male, you'll appreciate the fact that sometimes it just causes the scarring of the what? Urethra. So meaning sperms cannot easily travel to meet the eggs. You get that?
Yes.
Yes. So you'll also get to realize that sometimes it causes a lot of discomfort. Yes.
Sometimes, does this also affect the performance of a man on bed?
Yes. It really affects, because sometimes we shall have it affects both the man and then the woman.
Man.
There's what you call postcoital bleeding after having sex.
Yes.
You get to realize that after having sex with a woman, for the woman will bleed, of which it's disgusting.
Yes.
Then sometimes it affects a man in such a way that a man will feel a lot of pain during ejaculation.
Wow.
And you know, with pleasure, it is brain mediated.
Yes.
Yes. Once you're ejaculating or you're having sex and you're pouring or bringing out that sperms, that is where the sweetness comes in. So ask me that, can sweetness and pain move together? No. Definitely pain will outweigh that one.
Yes.
So meaning a man will fear so much to have what? Have sex. So in turn it's going to affect the performance of the man in bed.
Yes.
Yes.
Yeah. Thank you very much for that, Norman. I understand you said this when not treated, because sometimes when not treated is friendly in a way. And does it mean that we have stages of urinary tract infections? And what are these stages?
Like I told, that bacteria or that infection that is already there, if it is not combated or it is not, the chain of that infection is not broken, we shall appreciate the fact that it's going to start affecting other what? Organs.
Organs.
Yes. Whereby even the kidney at some point will be what? Affected. Now that is the long-term complication that comes as a result of untreated what? UTI.
Yeah.
So you get to realize that it's going to move from a very, very combatable stage to a stage that needs a lot of technicalities.
Yes.
For it to what? To be affected. Yes.
Wow. Having realized all this, maybe you make it clear some of the clear signs and symptoms of this.
The most prominent signs and symptoms of urinary tract is burning sensation. This is where most people will realize that they are having what?
UTI.
Yes.
Infections.
Yes. You get to realize that you go to sleep.
Yes.
Maybe you wake up in the morning after having sex with an infected person, or after some few days, you go and urinate. And then you start feeling that something is really burning you. That is already very big signs of this what? Urinary tract infection.
Yes.
Yes. We shall also have fever. Because it's an infection, there will be fever. All these are mediated from the brain. We shall also have postcoital bleeding. We shall have pain during ejaculation.
Yes.
As the infection progresses, we shall have discharge.
Discharge. Okay.
Past discharge. Whereby this past discharge can range from, we all know the color of pus. It can range from that milky discharge to yellow discharge. That shows the severities of that infection.
So when you talk of milk and yellow discharge, could you differentiate between these two colors? What does it mean?
You know, with the milky discharge, it happens within the first days of the onset of this infection.
Yes.
Yes. And you will appreciate the fact that during these days, you've seen how milk is. That's the color. And we all know blue band.
Yes.
The yellow discharge is like that blue band.
band.
Yes, it's just like that blue band.
Okay. Does it mean like when you have a yellow discharge or white discharge, you are in a particular like complications, or the complications is
the infection is getting intense.
Yes.
It's intensifying. Sometimes somebody will be like, is it the sign of that UTI? Discharge or discharges are signs of very many infections. that we are right now we have started looking at the urinary system.
Yes.
We shall talk about other infections like the STDs,
Yes.
which includes the gonorrhea, the syphilis, all presents with that what? That infection. I mean that sign of discharge that you're talking about. Yes.
Yes. Maybe how related is UTI and STDs you are talking about, gonorrhea? Because some people tend to like relate it to confuse them to syphilis, gonorrhea, all those.
There's what we call differential diagnosis.
Yes.
These are diagnoses that ask the same signs and symptoms with each other.
Yes.
So you'll appreciate the fact that in our differential diagnosis of urinary tract, we are going to bring syphilis, we are going to bring gonorrhea. Why? There is discharge, there is burning sensation, okay?
Yes.
Yes. Which makes it more similar to what? UTI.
Yes.
So what will now distinguish this is the diagnosis that we are going to make.
Yes.
The laboratory results that we shall have. Yes. So in other signs and symptoms, sometimes we shall also have waist pain.
Waist pain.
Yes. This comes as a result of the organs within the pelvic region getting inflamed. Sometimes we shall also have blood discharge. When you urinate in your blood, we shall have what?
Blood.
Blood. In the urine, we shall have blood in it. Yes. And sometimes the urine that you're going to bring out has some bad smell. Then itchiness.
How about the color?
The color will depend on the severity of the what? Disease. But starts from yellow to tea-colored urine, depending on how severe the infection is. Yes.
But can someone stay for months or days without realizing this? That he has got this infection?
Yes, yes. Like I told you, it's a very, very friendly infection. It will give you a warning signs, and then you're going to feel as if something is not okay. Sometimes if you decide to treat it with few tablets,
yes.
You know, in this platform we are not going to give the names of this.
The prescriptions also.
Yes.
Yes.
I'm not going to give it because we are going to encourage over-the-counter medication.
Okay.
That is very, very risky for our what? Health. So sometimes somebody will go and get an antibiotics and swallows. That signs and symptoms will what? Go off. So this person can even stay for months, very good month, without what? Having these signs. But remember that untreated UTI,
yes,
you're upgrading to another what? Infection.
Yes.
Yes. So basically those are the signs and symptoms.
Wow.
Yes.
Yes, thank you very much. I believe you are still following and you are getting at least a tip on this infection right now. And I believe with time you have to get Norman and get his contacts so that you can get in touch on how best you can treat this disease. But before you get in touch, let's first hear from him and let him advise us what to do. Having realized that we have these infections, what can we do? What can we do to avoid more other complications or more infections?
Thank you so much, Bendril.
Yes.
I'm not a believer so much in just guessing.
Yes.
It is very cardinal that we first of all do a laboratory test for us to ascertain that this is the urinary tract that we want to treat.
Yes.
Okay? Or is maybe a sexually transmitted disease that we want to what? Treat. You get that?
You may end up treating
something else.
Something else.
Yes. So it is always very, very important for us to do a thorough laboratory tests, whereby if you're in love, we test both couples to make us treat well. But with the treatment is basically antibiotics and other treatments that will help these antibiotics.
Yes.
If you come at Life Spring Medical Center, that is in Kirombe, Tealoy, you've been positioned to have all these treatments at a very friendly price.
Yes.
You get to realize that once you're there, you've visited us.
Yes.
You're going to get all the treatments that you want. You're going to get all the advices. But just know that with the treatment is basically treating and eliminating this bacteria.
Yes.
Meaning we are going to so much treat the bacterial infection and then the pain that is related to this.
Yeah.
Yes. So basically,
yeah, understand, like, you are not supposed to recommend, like you said, over the counter. Over the counter.
If I'm to say that,
yes,
please, you go for drug A. Tomorrow, there are very many people.
Yeah, because we understand this is one of the sensitive diseases around, and most people don't want to disclose this out. And if you are to give the
the drugs
like that, many people will just go over the counter and go and treat themselves,
yes,
or which would be harmful to them. And there's something we are trying to forget. Like, let's say someone with multiple sex partners. What risk does this person bear?
This person bears a very, very high risks. First of all, he or she does not know who gave him or this infection.
Yes.
You get that? So it's very, very good. This one I'm now giving non-pharmacological what?
Yes.
Treatment.
Yes.
Always have a single sex partner, whereby you know if something comes out.
But someone would say, outside that would say that would that's very hard in this generation.
Yeah, it's very hard in this generation, but health-wise, it's very healthy to have a single sexual partner.
Yes.
Then secondly, try as much as possible to maintain that proper personal hygiene. Yes. Clean yourself. For a lady, you can use feminine wash to wash that genital area. Make that area the epitome of pride. You get that? Because that is where a lady is called a lady.
Yes.
Yes. Let that place be very clean. If you're doing your menstruation, make sure that you put on that pads for about 4 to 6 hours and change another pad.
Yes.
You get that? If you're using disposable, discard it. If you're using reusable, go and wash it.
Dry.
Make it dry under the sun. And then you iron it. And then for our gentlemen,
yes,
please try as much as possible to embrace circumcision. Yes.
Yes.
Circumcise yourself. You're going to prevent this by some good percentage.
That's nice.
Yes. And then also, if you don't want to get circumcised, that foreskin, always make sure that it is clean, because it harbors bacteria. That bacteria will follow that urethra and it's going to inflame that urinary tract. Yes.
Okay, places that gather a lot of people, and I believe sometimes there are always washrooms and shelters that people do share. And does this also put us at risk?
Yeah, it puts us so much at risk, because now, if I, I am really putting much emphasis on the ladies, because this affects ladies so much compared to men.
Oh, yes.
Yes. If you go and that urine from a public toilet splashes in you, it poses you so much at the risks. But a man, sometimes you go and stand and then you urinate. For it to splash and then comes back to you is very, very, it's not so high and so common. But nowadays, with that urinal that you just stand and it's near you, that splashes can also what? Comes and poses you so much at a risk. Yes. And so public spaces like that, urinals, the public toilets, those gatherings that you need to go and urinate puts you so much at a risk. So how do you try and then you mitigate this? Yeah, you'll appreciate the fact that, first of all, bladder care is very important. If you know that you're going to somewhere that people are so many, try as much as possible to control your bladder. Okay? You can urinate from home, and then if it is not for long hours, you go back and then you urinate from home. Wow. Because at least from home is very safe. You get that, eh? Sometimes before using that, get water maybe with jig. You disinfect with that place, and disinfecting will mean killing this microorganism.
Yes, that brings me to a question, like using public toilets and public washrooms. there has been a misconception that bacteria normally follow your urine when you're urinating, and then what's the possibility of the bacteria following your urine
and then it gets inside?
Then gets inside you.
One of the ways of mitigating urinary tract infection is urinating.
Yeah?
You get that?
Yes.
So you get to realize that after having sex,
Yes.
you need to bathe,
Yes.
or you need to urinate to flush out that. Taking enough water will stimulate that urine to what? To come. So that is a myth that is not yet studied, and the answers has not yet been got.
Yes.
That you, as you're urinating, it follows. No, it doesn't. For that bacteria to get inside, it needs to have that agent, or we must have that mode of transmission in place, whereby like that splashes gets in direct contact with maybe your genital area.
Maybe before we conclude, and there could be another interesting topic or subtopic about this UTI, and you would love to share it out.
For today, too much consumption of knowledge is not a problem.
Yes.
Yes. But I want us to start something that will be in our next episode.
Yes.
Every week we shall be bringing this on focus.
Yes.
We shall be looking at that disease that is really affecting the community.
Yes.
And I want to talk about pelvic inflammatory disease.
Pelvic inflammatory disease.
Yes.
Yes.
In our next what?
Discussion.
Yes. So I will be very glad answering to you people.
Yes.
Make sure that you comment, you ask questions.
Yes.
In that video,
Comment section.
the comment section,
Yes.
we shall be in position to answer you. Or you can call direct on 0778 78 5201. 0778 78 5201, or 0392 972 444. 0392 972 444. You'll be in position to locate me wherever I am, or you can get time and come at the facility.
Yeah.
If
location of the facility.
It is in Kirombe, Tealoy, Center Tealoy. If you're from Lira Town, you're going towards Akwoyo.
Yes.
When you reach that market called Chuk Tealoy, please feel free to ask anyone from there about Life Spring Medical Center.
Yeah.
We shall be in position to handle your condition with a lot of professionalism, so that we bring out the holistic care and healing towards that.
Thank you very much, Norman, for your time. And wow, thank you for your time. Thank you for having kept us a company since the first minute of this show, and it's the first time we are bringing this on focus to you on Lerascoop TV. I remember in our next edition, we also have another engaging topic that we are going to share with you, an insight about pelvic inflammatory disease that we are going to discuss here, and we are going to bring for you the science, the symptoms, and some of the common causes that you may need to know so that you can avoid and mitigate all this. Thank you very much. My name has been Ben Rolopio. Please like, share, subscribe. We are here to help you, and we are here with Life Spring Medical Center.
Thank you for watching Lerascoop. We are glad you are here.